Hello everybody, my name is Addie Heitzinger. For my pharmacology presentation, I will be presenting the drug Rezdiffra. The generic name is Resmetirom and the brand name is Rezdiffra. We'll be using the brand name for this presentation. The drug class is thyroid hormone receptor beta agonist, and we'll get into what that means in a couple of slides. So the FDA-approved use is for treatment of NASH. So along with diet and exercise, it's used for treatment of non-cirrhotic, non-alcoholic steatohepatitis, better known as NASH, which we'll be using throughout the presentation, with moderate to severe liver fibrosis. So NASH, in case you didn't know, is a progression of fatty liver disease. It can include hepatitis, like inflammation of the liver, and possible fibrosis of the liver. NASH can progress to cirrhosis and liver failure. Let's discuss the mechanism of action. Rezdiffra is designed primarily to activate the thyroid hormone receptor in the liver. Our bodies naturally use thyroid hormones to regulate many body functions, including metabolism, but what's special about this drug is it really only activates the receptor in the liver. So other areas that can be effective, for example, are our heart and our bones, but because this drug is selective for the liver, it reduces specifically liver fat without causing significant side effects in other areas of the body. Side effects of Rezdiffra include nausea, vomiting, abdominal pain, constipation, diarrhea, itching, or dizziness. Adverse reactions, however, there's a risk for hepatotoxicity, and then gallbladder related reactions like cholecystitis, cholelithiasis, obstructive pancreatitis related to those gallstones. From the readings that I've done, there are no current contraindications or black box warnings for Rezdiffra. In terms of patient education, we would explain what it is and how it works. So we would tell our patients that the medication is to help reduce fat buildup in the liver, which is helpful for treating conditions like NASH and fatty liver disease. And then we would explain, again, like I said earlier, that the liver has special receptors that respond to thyroid hormones, and this drug targets those hormone receptors in the liver to reduce fat, and it doesn't affect other places like the heart or bones. We would also explain how you take it. It's usually taken once a day by mouth. You're not to crush or chew the tablet. And then explain if the dose is missed, take it as soon as they can remember, or unless it's close to the next dose, then skip that dose and take it on the next regular schedule. We would also explain possible side effects like nausea, vomiting, diarrhea, abdominal pain, constipation, itching, and dizziness. And then things to consider, doing lab tests, like we want to make sure that we're watching their liver function tests, their cholesterol levels, and then just make sure that they know that it's not well studied for pregnant or lactating women. So generally, if it's not well studied, it's not recommended for this population. The other thing we want to talk about is when to call the provider. For example, if there's severe or persistent diarrhea, if there's an allergic reaction, or if they have a rapid or irregular heartbeat. And here are the list of references that I've used for the presentation. Thank you for listening, and I look forward to listening and viewing your PowerPoints and seeing what you think about this drug and my presentation. Thank you so much.